An area of research that I have spent a lot of time on has to do with lifestyle interventions. I focused a lot on obesity treatment, and this is basically behavioral counseling for obesity. These lifestyle interventions involve dietary counseling, exercise counseling, and behavioral modification, and perhaps many of you are familiar with these protocols. One of the most notable is the Diabetes Prevention Program. Has anyone heard of that? The DPP, we call it. And then the next generation of that diabetes prevention program, lifestyle intervention, was the Look Ahead trial, which was more recent and focused on individuals with diabetes. So these studies were enrolled people either with pre-diabetes or diabetes and looked at the efficacy of lifestyle interventions, very intensive lifestyle interventions involving multiple visits over a year's time, and lots of support around weight loss. And they had actually quite stunning findings. And there were several trials with long-term follow-up on 3 different continents, in fact. The Finnish diabetes prevention study, there was one in the US, and then there was one in China, and then most recently the Look Ahead. And you can see very impressive follow-up findings in terms of the effects of these lifestyle interventions in preventing diabetes and managing diabetes. So these are wonderful interventions that work, and we have this wonderful data and even have long-term outcomes on clinical events having to do with diabetes and heart disease. But unfortunately, the public health impact of these interventions has been quite disappointing. And in the US at least, and perhaps here too, there are many reasons why they're disappointing, and they're very expensive. So they involve many visits, like I mentioned, lots of support. They involve training, and most providers don't have the training to do this type of intensive counseling. They require lots of resources, and so it just hasn't been a model that's fit well into our healthcare system. Primary care physicians don't really have this sort of time to spend with patients. They can't have patients coming in weekly to do an hour of counseling. And then dietitians and behavioral providers could do it, but they, at least in the US, don't necessarily get reimbursement for doing this type of counseling. So it's sort of this really missed opportunity where we have this efficacious intervention that really hasn't gone anywhere in terms of reach, dissemination, and public health impact. So I think that's sort of unfortunate, and I began to wonder as I became more familiar with social media is perhaps there are ways that we can engage with patients using online social networks to bring some of this behavioral programming, not just lifestyle interventions, but other behavioral interventions, to the public, because this is sort of where they are at. So if you're not familiar with social media, what I'm referring to are these online social networks like Facebook, Twitter, Instagram, WhatsApp. There are all kinds of different ones, and they're basically any sort of platform that allows people to interact and exchange information with each other. How many people are on Facebook? Lots of Facebook users. How many on Twitter? Oh, lots of Twitter users. Instagrammers. How about pinners? Who's pinning on Pinterest? Okay, so lots of social media users here. And I could go on because there's so many different social media platforms, and they're sort of changing and growing all of the time. But like I said, about 80% of Facebook users actually are accessing it through their mobile device, about 75% of Twitter users. And on Instagram, you'll notice you cannot post a picture without your mobile phone. It requires mobile to even use Instagram. So I'm very interested in this. And there was also some research several years ago, maybe you have heard of it, by Christakis and Fowler. They did this sort of landmark study showing that obesity may be sort of socially contagious, or it spreads through social networks, such that they found in the Framingham Heart Study database that people who were obese were more likely to have neighbors and friends that were obese. So these weren't necessarily family or genetic connections, but when we have friends, neighbors, and other coworkers even that are obese, we're more likely to be obese. So we may share habits amongst each other. And there have been subsequent studies since that landmark study, which actually led to a book, I think it's called Connected, by Christakis and Fowler, that shows that health habits are shared in social circles. So smokers are more likely to have friends who are smokers. People who exercise tend to have more friends who exercise, and so on and so forth. So birds of a feather flock together and we influence each other. The challenge then, if you're wanting to get healthier or lose weight or change your lifestyle, it may be helpful that you find some healthy friends to do that. And a lot of the patients that I work with, this is one of their number one struggles, is they'll say, I really want to get healthy, but my spouse is a couch potato, and my friends don't like to exercise, and they always want to go out for pizza, and so it's so hard for me to change my lifestyle because everyone around me is sort of working against me and makes me feel uncomfortable making these changes in my life. And that's a big barrier for them to follow through on the things that I'm trying to counsel them to do. But the good news of this sort of social network effect is that once you do adopt healthy behaviors, you may find that other people around you begin to do so. And I actually have a friend who lost a lot of weight, and then everyone, several people at her work, were like, oh, what did you do to lose this weight? And then they started sort of joining her and in her physical activities and that sort of thing. And it had this sort of social network effect. And so with social media, we have this opportunity to really take advantage of any effects that happen through social networks, because social media has sort of opened up our ability to connect with one another. It's made the world a much smaller place. Now, I got on Twitter a few years ago, and one of the reasons why I got on is because I started a weight loss blog, and I wanted to tweet my blog posts and find people who might be interested in reading what I write. And so it was interesting because I found this world of people who tweet about their weight loss and their health conditions, their diabetes, all of these communities on Twitter around health. And then I learned that there's actually a word for this, and it's called peer-to-peer healthcare. And a few years ago, the Pew Group actually tracked this phenomenon. I wish they would update their numbers because I'm sure this is something that's increasing. And that over a third of internet users have gone onto the internet to read about someone else's experience with a health condition. So this is different than going on to WebMD and trying to diagnose yourself. This is going on to find somebody else, for example, who has breast cancer, because you want to see what they've had to say about it or learn about their treatments and that type of thing. There's actually a very neat social network called Patients Like Me. It's headquartered in Boston. And this social network is for people with a health condition. And so you can start a profile. Let's say you had breast cancer, and you start a profile, and the profile will say, I'm a 43-year-old woman, I have breast cancer, so on and so forth. And the idea is so that you can find other people with your condition and talk about it, talk about the treatments that you're receiving, just support each other, and so on. And so there's particularly a lot of use among people who have rare diseases that may not know anybody else with their disease, and so it gives them the opportunity to talk to other patients, which is something you don't always have the opportunity to do. I mean, even if you have diabetes, it doesn't necessarily mean you know 12 other people with diabetes, and it's different to talk about your diabetes with someone else who understands than it is with your family and friends. And so this need for that type of social connection is being met by this really interesting website. And they're actually very research friendly, this company. So if this is something that you're interested in, you should approach them. But even Facebook and Twitter, you will find communities around health. People create pages to motivate each other to exercise, or around diabetes. I do a lot of work in skin cancer, and I follow a lot of pages by melanoma survivors or family members of people who are affected by melanoma, and they create these communities to educate each other. And many of them have a wealth of information. I learned a ton of things by following these communities. Then, of course, there's weight loss communities. Spark People is a popular one. Weight Watchers, of course. So this idea of peer-to-peer healthcare, this is kind of patients getting very activated, like we hope that they are, and activated to connect not just with providers but each other. So because I got so interested in this, seeing these people talking about their weight loss on Twitter, I thought I'd like to study this, because I found it a little bit surprising that someone would go on Twitter, which is such a public social network, and talk about their weight loss journey, and just tweeting along like, oh, today I exercised, or I weighed in this week and I gained a pound. Typically it's sort of a private thing, it's very personal for people, but here they are just going along each day, basically journaling publicly their process. And so I really wanted to understand why are they doing that and what are they getting out of it? They must be getting something out of it. So we surveyed people who do this to find out a little bit more about the type of social influence they're experiencing from these strangers that they're interacting with on Twitter. And is it positive, negative? And how does it compare to what they're getting socially from their in-person ties? So we, of course, tweeted our survey to get at these other tweeters and got 100 complete surveys. And basically our tweet was like this: do you tweet about your weight loss journey? If so, fill out this questionnaire. And so we evaluated 5 areas of positive social influence for weight loss and 2 areas of negative social influence. Our participants were largely female and average age around 38 years old. The average body mass index did fall into the obese range. There were some people who were normal weight, and just anecdotally I can tell you there are a lot of people on tweeting about their weight maintenance after having lost lots of weight, and so some of these I suspect might be maintainers, and then other people might be people who are thin who just want to get thinner. But interestingly, we asked this question: how much weight have you lost in your most recent weight loss attempt? And this is self-report, so you always have to kind of remember there's bias with self-report. But interestingly, on average, it was 44 pounds, which is a pretty successful weight loss effort. It's a big range, but the median was about 28 pounds, which still, these people are doing pretty well with their weight loss, so they're pretty successful. So we wanted to understand kind of how they use social media, since we were asking them about Twitter, and we did ask them some questions about Facebook. We were curious, like, are these just like really Twitter people, or are they into Facebook as well? And their social media activity comparing Twitter and Facebook were very similar. They had accounts just as long, they logged in just as often, had the same number of friends and followers. The only major difference was that, and if you're on Twitter and Facebook, you probably already know this, that most of the people on Facebook you're connected with, those relationships originated from an in-person relationship, whereas on Twitter, that's less likely to be the case. So it was only 15% of their Twitter follows were actually people that they had met and had an in-person relationship with. So basically, they're chatting with strangers for the most part. So these were our items, and we took these items off of social support for weight loss scales, and we hand selected them because on these scales for social support, many of the items have to do with things that you can do in person for somebody, like we exercise together. And obviously, if you're chatting with Twitter friends who you don't have an in-person relationship with, you're probably not exercising together. So we picked ones that are ways you could support or be negative towards people, both on and offline. And so we asked them, how comfortable are you talking about weight loss with your Twitter friends, your Facebook friends, your in-person friends, and your family members? So we asked them the same questions about those 4 groups of people in their lives. So how comfortable, how helpful, how supportive, how much information are you getting, and how fun is it? How embarrassed do you feel about your weight when it comes to these people? How judgmental do you find these people? These were highly related, so we made a composite score. These actually were not, so we left those as individual item level. So in terms of our composite score for positive social influence, what we found is that people actually rated their Twitter friends as more positive on those items than their Facebook and their Facebook friends, their family, and their in-person friends, which I thought was interesting because, again, these are largely strangers, if we're calling strangers people you've met online. So I use the word stranger loosely. In terms of negative social influence, the same pattern happened in that people rated their Twitter friends as less negative in terms of embarrassment and judgmentalness than the other 3 categories. And interestingly, even though this wasn't significant, you can see kind of the most negative group of all is family. So I guess if you want to get judged and embarrassed, you don't even need to leave the house, right? So, but total strangers won't do it as much. And this is interesting also because you guys have heard of trolls online, right? There's people who go on and they just like to say negative things and be rude, and they enjoy that. So you would think that maybe some of that negativity would be coming through in these communities, but we really didn't see much evidence of that. Our conclusion was that, it could be that people who tweet about their weight loss may be lacking support from their in-person relationships, and this is what's pushing them to online social networks. Or it could be that they just like to get as much support as possible, and their online connections just sort of, because they're sharing the journey, might get them a little bit better. We asked them some open-ended questions about what they liked the most about it and that type of thing, and we put that in the manuscript. The paper is published, you can check it out. But some of the themes were people liked the anonymity of it all. They liked having common goals, and they felt like there was less stigma and shame around having these conversations online as opposed to with people in person. And they felt particularly strongly about stigma and shame when it came to Facebook. So I thought that was interesting too. One thing about social networks that are online versus in person and why they may become more positive is because they're very handcrafted. So it may be easier to eliminate people because you're on Twitter, and if you did encounter a troll, there's a button that you can click and that person is away out of your life forever. You can unfollow or block, and it's like, goodbye, we're never going to speak again. But with your in-person friends and family, there's not a button. Sometimes we wish there was a button, but there's not a button. It's harder, there's more drama if you want to eliminate one of those relationships. And even a Facebook friend, there could be some drama if you were to unfriend somebody. And Facebook has like little ways where you can sort of unfollow but not unfriend. Because if you went and unfriended like a negative cousin or something, you might get a phone call like from your aunt, like, did you unfollow? Why did you do that? I'm upset. So there's drama, but with Twitter, the relationships, they're loose ties, so there's not the drama. You can just positive people in, negative out. And that's just how you create your world. So then we thought, if people are chatting amongst themselves about weight loss, then maybe we as healthcare providers should be in that mix. Because another thing I noticed being on Twitter is that there is a lot of misinformation. There are a lot of people who, they'll sort of assign themselves some sort of title that makes them an expert about nutrition or physical activity, and then they'll blog about it and try to get people to follow them, but they're really putting forth misinformation, and that's unfortunate. So I really think there's an opportunity for healthcare professionals to be the voice of the evidence base around these things, and so maybe there are ways that we could be interfacing more, or just using these platforms as ways to interface even privately with patients. And so that's what I've been doing in some of my more recent work. So we did this series of pilot studies, which I called Get Social. And what we wanted to know is it feasible to actually use these platforms to do counseling? And these platforms as in Twitter and Facebook. We were also interested in, can we recruit and retain participants using these types of platforms and interventions designed using these platforms? So we did 4 sequential pilot studies, and each one sort of informed the next. The first one actually did not have a social media piece at all. We just did a standard group-based lifestyle intervention just to have like some data on the standard intervention, which involves 12, we did a pilot version, so 12 weekly visits. They came in, we did the counseling protocol. In the second one, what we did is we brought in the Twitter piece. So we created this private community on Twitter, so all the participants were connected to each other and the coaches. And so in between those 12 visits, they had this opportunity to continue the conversation, ask questions, and get coaching. In the third pilot, we decided maybe we'll just dump the visits all together and see if the whole thing falls apart. So we included one visit, but we wanted to see, can we just offload all of the counseling onto the Twitter? And then finally, we moved from Twitter to Facebook to experiment with a different modality and see how people felt doing this on Facebook. And in that group, we actually didn't have any in-person visits. The entire thing was online. So the first thing you're probably thinking of is, how on earth are you counseling people through Facebook and Twitter? Like, the privacy issues must be off the hook. But actually, Not as much as you might think. On Twitter, actually, privacy is really easy because there's two settings. You're either public or you're private. And if you're private, the only people who can see your tweets are the people who you agree to follow you. So it's so easy. Facebook is more complicated, as you may have experienced, and your privacy settings are hard to understand. But with Facebook, you can actually set up a private group, or they call it a secret group, in which all of the content that goes on in the group is not accessible by anybody, including friends of people who are in the group. So I would need to invite you to the group in order for you to be in it. And none of your friends would know that you were in this group or be able to view any of the content of the group. So you can create this private space, taking advantage of the platform of Facebook, which is so lovely and user-friendly and been iterated a billion times because they've been going for years and years. So that's kind of how we've created these private worlds using these platforms, as opposed to developing our own platform, which we actually did try on a mobile app. And it was horrible, and we thought, why are we trying to create something that already exists and is created by people who know what they're doing? We'll just use those platforms to the extent that they can meet the needs that we have. So the next question is kind of, how do you counsel people in a social network? Because it's different than, if I have a group of 10 patients come in and we do counseling, we're there for like 90 minutes, we have these conversations. What we didn't want to do is to just schedule groups online to where we still have that 90-minute meeting and that type of thing. We wanted to make it more like what people are used to in terms of having conversations in this online setting. And so you'll notice when you go on Facebook, you don't meet people, and you won't be like, I'll see you on Facebook at 4. Like, no one does that. You just log in when you have a chance, like perhaps right now. And then you see what's going on, you make a comment, and it's sort of this, flowing, open-ended, amorphous conversation, very asynchronous. You post something this morning and you see comments throughout the day. So we want to do counseling in this way because that's how people are used to using these platforms. So we don't want them using it in a way that's inconvenient. And the one thing about scheduling group meetings and traditional interventions is that then you got to get everybody available at one time, and that's logistically challenging. So I call this micro counseling, and so it's that type of engagement that's just like you would engage normally on an online social network. So in terms of the content, we converted that content into articles, short articles that you would be likely to see, on your Facebook page. Someone posts a link to an article, and we were mindful about the length of the article, so we didn't want to post things that were like super long or that didn't have images or videos and things like that. So we tried to, again, make it just like the type of things you might see on Facebook. Knowing the kind of things that people are likely and unlikely to click on. For example, you're probably not going to click on a 40-minute video on Facebook. So you're browsing and someone posts a 40-minute video, no one's watching that. But maybe a 1-minute video you would watch. So we were trying to be very mindful around kind of the habits of Facebook and Twitter users. So the coaches would start these conversation strings. Usually in the morning, a string would be started, and each week would be thematic. So like maybe this week is about physical activity, ways to get active. And so each day there would be a conversation string started about that, combined with some content in different posts. And then participants were sort of given some coaching about how to use it, like post your successes, your goals, your victories, and that type of thing, so that there's a sort of ongoing conversation all of the time. To give you kind of a picture of an example, one time here was a post, I guess it was Halloween, and one of the members of the group posted this at 8:30 a.m. I guess some people brought some donuts to work, and she was like, oh my gosh. And then here's sort of what transpired throughout the day. Someone said, be strong, step away from the break room. And then someone, tried to resonate. Oh, we do that too. And coach chimed in an hour or so. Imagine walking out the door knowing you resisted and how good that feels. And then finally, later in the day, the person came back and had a really nice report. They resisted the temptation, and it sounds like had conversation about it at work and decided with some coworkers to do something a little bit different. But that's really characteristic of a conversation string you might see. So across these studies, we had a total of 54 participants. And again, they're mostly female. This is one of the things in our weight loss studies. We do pull a largely female, Caucasian demographic. They're definitely treatment seekers for this type of thing. Average age around 54. We recruited people between a 30 and 40 BMI range. In terms of social media experience, in our Twitter group, the participants were new to Twitter, so they were not active users because we wanted them to, we didn't want some of them to sort of have an account and some not. We had them develop a new account for this, and so we wanted to kind of have them have no biases or mixed experience with Twitter. In the group that had both a group and Twitter, 63% did have Facebook accounts, so they had some social media experience. When we got to the Twitter-only condition, we did require them to have Facebook accounts because we noticed that people who had no experience with social media really struggled kind of just understanding social media. And so we wanted to sort of eliminate that barrier and just focus on people who had some experience with social media, so they kind of got kind of how it all works and how the conversations go and that type of thing. And in our Facebook group, we did require them to be active Facebook users. So you'll see we had sort of an increasing guideline around how much social media experience they could have. In terms of our measures, obviously we measured weight in person. So we did have people come to the clinic to have their weight taken. Social media engagement was tracked weekly, so we would pull that data off of the platform to see how much people engaged. And we also tracked people dropping out, whether people didn't come to that follow-up visit and then discontinued participation. So to make a long story short, here's our findings for all 4 of our groups. So here's our traditional group, and in terms of percent losing clinically significant weight is about 25%. We had 2 dropouts. And again, these are small samples. When we added the Twitter group, it was fairly similar, same number of dropouts. And for this, we were able to report tweets because they actually had the Twitter piece to it, so you can get an idea of over 12 weeks how often they tweeted. Then when we dumped all but one of the in-person visits, we had at least as good, if not better, weight loss findings. In terms of dropouts, we didn't have any dropouts, and that was the same for our Facebook group, where we had better, if not the same, weight loss and slightly larger group, but no dropouts. The thing about the no dropouts, I actually found personally to be the most interesting, because these are small groups, so the weight loss findings we don't want to compare statistically because they're too small to really make any sense out of that. And the point here was more feasibility than anything. But in terms of the dropouts, it's not that we didn't have people asking to drop out, because we did. But when we reminded them, we said, you can, I'll give you one example. There was one woman who said, my dad just had a heart attack, like I need to leave the state and go take care of him. I don't think I can be in the study anymore. And she was in this group. And we said, well, you don't have to drop out right now. I think it was maybe week 4. You can stay in, or you can come back later, because there aren't really any visits, and it's okay if you miss the one visit. So if things clear up for you, and just keep us in mind, and no stress. And then a few weeks later, she did come back, and she started commenting again and engaging again, and she gave the whole report to the group. She's like, oh, you guys, thanks for your support. My dad's doing so much better. And she kind of got right back into the swing of things after disappearing for maybe 2 to 3 weeks. In an in-person intervention, my experience is if someone's kind of off the grid for 2 or 3 weeks, it's rare that they come back, because I think they feel like they've missed things and gotten out of it. But with the social network, because that conversation is just sort of so fluid, and you can go back and visit what you missed, it seems like people are a little bit less inclined to just completely exit the study, so they can sort of move in and out as their crazy lives allow, which I think has a convenience factor that's really important when you're trying to do something that really requires this sort of chronic care. So in terms of the association between engagement and weight loss, on our Twitter studies, we did see a connection between how often they tweeted and how much weight they lost. So the more active they were on the social network, the more weight they lost. Interestingly, on Facebook, even though it seemed like they lost a little bit more weight, we didn't see that engagement, weight loss connection. So I'm not sure exactly why that would be. And another interesting finding was in terms of longevity. In our Twitter groups, we found that when the study was over, people continued actually to tweet, even though we weren't doing much more with them. 67% of them continued to tweet after the study, whereas in the Facebook group, once the study ended, it was silent. Nobody posted anymore. And so there might be something about the interface that has a more final feeling, because we use that secret group, and maybe they felt like it wasn't a place to engage anymore, whereas on Twitter, many of them were following other people outside of the study, and they extended their networks, and it kind of grew beyond the study, whereas in a Facebook secret group, it doesn't have that sort of growth potential. So that's all that I can make of that particular finding. So we do think that it is feasible to do this sort of coaching using a social network. I think it's more convenient. As one of the coaches in some of these pilots, I'll say I found it more convenient than meeting patients in groups, usually in the evenings, which is, logistically challenging for everybody involved. When it came down to barriers, and we asked people at the end, what did you like, what did you not like? Most of it did have to actually do with the interface. In the Twitter studies, because they weren't used to Twitter, there were some challenges around the interface. That's why we switched to Facebook, because we thought maybe we should be using the platform that people are used to, so then we don't have platform-related barriers. And they actually asked for that. They were like, if you do another study, do it on Facebook. And we're like, okay, we'll do Facebook. From a platform perspective, I like how Twitter is set up. But from the experience of the participants' perspective, I think Facebook is better. The problem with Facebook when you're doing this type of thing is that you don't have a lot of control over how the feed is ordered, and everything goes into like one feed, whereas Twitter allows a lot of sort of side conversations without everyone having that crowding their feed. So there's sort of strengths and weaknesses to each, and I think it really depends on what you want to do with it in order to figure out which one is best for you. And also another thing to consider is the group of people that you're targeting. I would match the platform to what they're used to using. So if you're using younger people who have, a younger generation who doesn't like Facebook, then I wouldn't use Facebook, because they're going to be like, oh, Facebook, I don't care for Facebook. But I think from like a cost savings perspective, that doing this type of counseling this way may be beneficial. No patient visits, they don't have to come in, pay for parking, get babysitters, and all of these things that make all this patient care very, very intensive. I'm going to skip over a few things because I know I'm short on time, and just go to my closing thoughts so we have time for questions. But in terms of using social media, I think there's a lot of potential as a way to bring any sort of health behavior programming to people, and not even just in these private settings, but also when it comes to public health campaigns and just health behavior change programming in general. People are using online social networks. They're there. It's an opportunity for us to interface with the public, and so I think there are a lot of creative ways we could be thinking of how to go about doing that. And this concept of micro-counseling, I'm interested in further developing and figuring out how can we engage and have conversations with patients that does mimic how they interact on social network platforms. And so I think because social media sites have these large captive audiences, and Facebook just had a report about less than a year ago that said the average American spends 40 minutes a day on Facebook, or the average American Facebook user, I should say, 40 minutes a day. So imagine if we spent 40 minutes a day exercising, like we would probably be we could like wipe diabetes out. But we spent 40 minutes a day instead on Facebook. So we have this opportunity where people are there. So like, how can we grab them and shake them? So follow me on Twitter, and I'm happy to answer any questions that you have.
Thank you very much, Sherry, for that fantastic talk. We probably could take one or two brief questions, and there'll be another opportunity later on. People would like to ask more. Any questions? Back.
Hi, I'm just wondering, in relation to your study, did you have to, I suppose, advise people up front, especially either the existing social media users or people new to social media, that did you have to put a time constraint on the amount of time, just based on your last comment, that the amount of time that they spend on social media? Because one of the, I suppose, findings from a lot of studies recently is that people spend probably a lot of time on social media, joining lots of groups and spending a lot more time sedentary and doing this type of thing instead of actually getting out there and doing it. So did you have any difficulty getting the group on the actual study, or did you give them any kind of guidelines or rules at the start, saying 40 minutes a day and you're maxed out and you must get out and do the actual?
Yeah, that's a good question, and that would have been a good thing to do, but we didn't. We didn't give them any sort of guidelines around spending too much time on social media. So it would be interesting to take a look at among people who are in a weight counseling program, how much time are they spending on social media? Because the 40 minutes is just the average Facebook user, so it may be the case that people who have even more sedentary lifestyles and more issues with their weight are spending even more time on social media, and figuring out what is it that they're doing with that time. Like, is it engaging? Is it watching kitten videos? Is it, there are all these different types of things that we're doing on social media, and how to kind of help them create a social media feed that might be more health promoting by the kind of things that they follow, since there are all these pages out there, and also reducing the negativity in their social media feed if there are things that bother them. There's been some research showing that some people will feel depressed or isolated after looking at their social media feeds. So I think there's a lot of opportunities to kind of explore and look into that. I mean, one thing that way that I think is a little bit better than our traditional format is that normally we have people come in for 90 minutes and sit for 90 minutes and have this counseling group, which is very sedentary, and I wish there was a way to make that a little bit more active without disrupting the process. But so I'm hoping that at the very least is less sedentary than some of our traditional modes of working with patients, but we have no idea actually.
My name's Alison Dunn. I'm a mental health pharmacist working in hospital.
You just like to speak up a bit, or if we could get the mic, if the mic's available, is the mic there?
My name's Alison Dunn. I'm a mental health pharmacist in the University Hospital Galway. Have you done any research into the negative influences on social media, for example, pro-ANA groups, and I've seen negative discussions about patients who are all deciding to stop antidepressants and talking about the negative side effects of treatments for schizophrenia and so on. There'd definitely be a role there for mental health professionals to intervene, and I'm very tempted sometimes to tweet back, but I hold myself back.
Yeah. Yeah, it can be hard to resist. But yeah, to where people are having discussions, you're going to find these types of discussions. People will cluster. I haven't done a lot of research on that, except for in one topic that's quite different. And one of the things that we were looking at is I do some work in skin cancer prevention, and we looked at tweets where people were reporting negative adverse effects of tanning beds, and pulling those tweets off of Twitter and taking a look at how people are talking about that. And it was very eye-opening in that people were tweeting right from their tanning bed, talking about how burnt they were getting and blistering and things like that, and taking selfies in the tanning bed. And so with that research, we're really trying to show that maybe the dangers of tanning, or using tanning beds are more than we're aware of, because a lot of that is probably not landing in an emergency room or at a physician's office, but there are all these conversations about it, because we have this data that we didn't used to have, and people are, doing these things. Another thing we realize is that people, because they're tweeting and texting in the tanning bed, they're not wearing the protective eyewear, which is so important when you're in a tanning bed. So I think there are some really interesting opportunities looking at the negative health-related things that people are talking about on social media, and are there ways that we can, because what I'd like to do with this is figure out, are there ways that we can find the influencers within these groups of people and send health messages into them in ways that might move the needle on their behavior. So.
Thanks very much.
Mhm.